Hello, this is Dr. Gay from First Look MRI. And this is a 43-year-old male who came in with swelling in both of his elbows. The swelling had slowly progressed over the past few years. He went to his orthopedic surgeon and they were unsure what was going on. The x-rays were normal and he had limited range of motion. He couldn't fully extend his elbows and they just felt sore at night. And so his orthopedic surgeon said, go get an MRI and to see what is going on since the x-rays look normal. But he had some pretty striking findings here. This is his humerus coming down, and this is his forearm here, and we see that there's lack of full extension. Normally the elbow will be open and the bones will be straight, but there's a significant, maybe 30 degrees of flexion, and he has a large amount of fluid. These areas that are bright in the back here and in the front, this is fluid. So a very large joint effusion. And it looks a little dirty too. Instead of being really clean, there's little areas of nodularity within. This is synovial inflammation, so diffuse synovitis and a massive joint effusion. Also, the marrow is not normal. On this one, the marrow should be dark like this, but in here it's too bright, and the radius here is too bright through the radial head and neck and all the way into the shaft, very bright. So diffuse synovitis with marrow edema. Now we're going to go to the opposite elbow. This is the opposite elbow. We see very similar findings. A large, massive joint effusion with synovial inflammation. There's a marker, or an arrow rather, placed here to point out this loose body. There's a region back here in the posterior elbow. It's lobulated and low in signal. We call this a loose body or free-floating structure here. And again, that massive joint effusion. It has brightness in the bone here that's abnormal. And I'm going to put up another view to show this marrow change. It's very profound here, a little bit better. So this is a view looking in profile, and right here the arrow is pointing to darkness beneath the humerus. This is the humerus coming down, and this is beneath the articular surface, really low signal, really prominent low signal. It's marrow edema. And on the radial side, this is the radius. It should be really bright like that. But if we go towards the inner side, there's an area of darkness. So marrow edema on both sides of this radiocapitellar joint. If we look on another view like this, we see that there's brightness on both sides of the joint. A couple of views like this show areas of darkness here in the forearm. This is the ulna, and this is the humerus. So areas of darkness meaning erosive changes in marrow edema. So in the end we have bilateral marked marrow edema with prominent synovial inflammation. And on one side, this loose body, and then erosive changes on both sides of the joints. Here's the other shoulder, the other elbow showing the marrow edema throughout the radius, and then the subarticular marrow edema, the capitellum. And so in the end, this has got to be related to a synovial inflammatory process. And since we see that loose body on the one side here in the back, this is most compatible with what we call pigmented villonodular synovitis, PVNS. It's a nonspecific synovial inflammatory process of unknown etiology, but patients get really severe swelling like this, sometimes hemorrhage into the joints, and they also get loose bodies like this. Sometimes they have multiple areas of low signal, these low signal loose bodies. But again, this is likely pigmented villonodular synovitis. Other things like rheumatoid arthritis could produce really similar findings of joint space narrowing and erosions and synovial inflammation and fluid, but again, probably PVNS. So he's going to go back to his physician, and they're going to probably refer him to a rheumatologist for further workup. And that's it. Thank you so much.